Hello, everyone. So I'm excited to share with you a case where a patient has a supernumerary located palatal to tooth number 4 and 5. So here you go. I would like to always start out with axial plane. So what you're seeing here is the axial plane going right through the roots of the maxillary right dentition. And as you look at this premolar region, you can see that there's an extra tooth, supernumerary, just parallel to these two roots, 4 and 5. You can see the enamel layer and associated expanded palatal cortical plate. So now let's take a look at that from the coronal view. And here we can see that the crown is positioned palatally once again within the alveolar process, and the root apex actually is near the buccal, located buccally within the ridge. So this is palatally tipped. Thankfully, as I was looking through the volume, I don't see any extra roots or multiple roots, nor or even dilaceration of the roots. So this is nice and straight, which is always nice if you have to consider removing this. And also there's no alveolar crest just inferior to the crown. So if you just do a small flap, you should be able to see the crown right away. One of the things that I like to look at, like to evaluate when I'm seeing a supernumerary or any of the impaction cases, typically I want to see if there's a associated root resorption. In this case, I think argument could be made for either case, whether there's a resorption of this palatal root of number 5 or not. If there is, it's very minimal, but there's no overt amount of resorption. That I think most of us can agree on. Whether there's a resorption or not, that's something we could probably argue, but I at least would say there's no significant resorption. Well, let's now finish the case by looking at this in three-dimensional view or three-dimensional rendering. So again, 4 and 5, and this patient is going through orthodontic therapy. And there's that extra tooth palatal, 2, 4, and 5. Here's a superior view of how they're located. And let's take a look at this from the lingual side as well. Okay, lastly, occlusal plane, occlusal view. There you go. So very cool, right? So again, having a comb MCT is really helpful as a surgeon or for someone who will be extracting this tooth. You definitely want to know the relationship between the supernumerary and the adjacent teeth. So again, comb MCT is it's proven to be a very important imaging tool for extraction of either third molars or in this case of a supernumerary. Thank you very much for your attention, and I will see you next time with another interesting case. Take care.